We are in Borno State, where we had the last case of wild polio virus. The insurgency in Borno has made it impossible for communities to access basic services for over 11 years. In order to reach every last child, we have trained and deployed over 20,000 volunteer community mobilizers. These brave volunteers, mostly women, are the backbone of the polio eradication program. They walk house to house daily, even in areas that threaten their own safety, to convince women and families to vaccinate their children.
Lafiyar al'umma haƙƙin kowa da kowa ne. This means that the health of the people is related to everybody. Everybody has to come and put hands together so that we should improve our health.
Hi, I'm Adia Depitan, Paralympic medalist, television host, polio survivor, and co-host of this year's World Polio Day.
And I'm Trustee Geeta Manik from Kenya, District 9212, and a long-time supporter of the fight to end polio. 2020 has challenged the world in ways we never expected, but there's still news worth celebrating.
Yeah, that's right. This year, Africa was certified wild polio free. Since I was born in Nigeria, this achievement is close to my heart, and I've been waiting for this day since I was young. Just over a decade ago, Africa was struck by 3/4 of all wild polio cases in the world. And today, more than 1 billion African people are safe from wild polio virus. But we're not done, because we're in pursuit of an even greater triumph, a world without polio, and I can't wait.
That's why we're here today, so that all of us can be motivated to continue this fight. Rotarians around the world are working tirelessly to support the global effort to end polio. But I don't have to tell you that. Let's hear it directly from them.
I'm a member of the Rotary Club of Cali San Fernando in Cali, Colombia.
St. John's, Newfoundland and Labrador in Canada.
RC Magboro Newtown Provisional, Ogun State, Nigeria.
Basel, Switzerland.
Kingston, Jamaica.
From Medellin, Colombia.
In Mauritius.
I live in the city Marília, Brazil.
Oshawa, Ontario, Canada.
Red Sea Coast, Egypt.
Rotarians in Brazil are committed with polio eradication. We organized Telepolio, a fundraising initiative with the testimony of Rotarians, polio ambassadors, an expertise panel, and an amazing entertainment.
We also have Pints for Polio events happening across our district. The St. John's East Club is going into their 4th year holding this event with a local brewery.
My club will be organizing a Rotary polio walk to keep polio at 0 level.
We are organizing a Let's Kick Out Polio online event with speakers from WHO, UNICEF, the Bill and Melinda Gates Foundation, and our Rotary International president.
Artists from all around the world sending their work for make this exhibition, to make a promotional banner about the fight against the polio.
We'll be co-hosting our 3rd annual live stream World Polio Day 2020. We'll be updating our live audience with Rotary's efforts to end polio now.
A 35K fundraising cycle ride to end polio now.
There will also be a virtual donation campaign for the Polio Plus Fund.
This year we are celebrating a polio-free Africa with influencers, leaders, and people from the media together with awesome speakers.
With this animal, we are making happy 1 kid at the hospital. On the other hand, we save 5 kids from polio.
The African region has been declared wild poliovirus free. Yes, but there's still a long way to go.
We want together to show how Rotary contributed in the eradication of polio and how vaccines play an important role in combating the disease.
It's not only connecting with other members that I enjoy as a Rotarian, but also other organizations who share our commitment to keeping communities and the world connected, healthy and resilient. Rotarian Mark Wright, a television journalist in Seattle, United States, interviewed our GPEI partners about their work with Rotary. Let's take a look.
I interviewed leaders from several of our global polio eradication initiative partners about what they've learned as they've mobilized their own experts over the past few months. They were generous enough to share their thoughts about how Rotary can be at the front of a new effort to safeguard our communities and the world. Let's take a look. Welcome to our panel. I know your schedules are incredibly busy. We really appreciate the time you're giving us today.
The polio infrastructure that Rotarians helped build with partner agencies have really played an enormous role in protecting vulnerable communities from COVID-19. What aspects of the polio program and its infrastructure have really been most helpful in fighting other diseases like COVID-19, Ebola, and yellow fever?
When there's an emergency, when there's an outbreak of yellow fever, when there's an outbreak of measles, they pitch in. They put their shoulder to the wheel. They take what they've learned from doing successful polio campaigns that have to reach all the children in the village, and they apply that to reaching them with yellow fever or measles vaccine.
When you have someone in a village who can identify if a child has polio or has Ebola or yellow fever or COVID and knows what to do about it, can help the parents know what they should do, this is a great gift to a community.
The surveillance system and laboratories that have been built that have allowed us to detect and to be able to test for Ebola or yellow fever, the ability to be able to use the laboratory and the knowledge of the laboratorians in countries that capacity has been built, and the people, the surveillance officers in the field who have gone out to find cases, who found contacts, and who have done the tracing that is needed.
The network, the infrastructure we built through polio in terms of how to engage communities, how to work with communities, how to rapidly teach communities to actually deliver health interventions, do disease surveillance, etc., has been extremely important part of the effort to tackle so many other diseases.
Rotarians have been leaders in the fight to end polio for around 35 years. And even as that program has faced difficult challenges, including the current COVID-19 crisis, Rotary members have remained dedicated and focused on continuing progress. What message would you like to share with Rotarians about their efforts?
I would like to thank Rotarians for your incredible efforts over the decades to eradicate this devastating disease, and to congratulate you, most importantly, on what you have achieved. 20 million children are walking today as a result of the generosity and the initiative of Rotarians. That's an extraordinary achievement.
You were the original planners and remain at the forefront of polio eradication. Your work matters, and we and the world need you.
Rotarians, you are almost there. This is an exciting, close to success moment for all of us in the world. I mean, if you think about what you're trying to accomplish, to end the scourge of polio, that you will save the lives of so many young children.
I'm confident that we're getting there, and that we're taking the lessons that we've learned in India, applied them in Nigeria, we're applying those lessons in Afghanistan, Pakistan. I think we're going to finish the job soon.
And thank you so much to our panel for joining us today. I know your schedules are incredibly busy. Thank you for sharing your time with us.
It's impossible to talk about this year and not mention COVID-19. It's changed the way we work, socialize and celebrate. And while it's impacted our polio eradication effort, it hasn't stopped it. Let's learn more about how the infrastructure that GPEI has built over decades is evolving and making an impact that extends beyond polio eradication.
When a crisis hits, we look for solutions and react to the challenge of the moment. In 2020, that's COVID-19. And as the world races to find a vaccine, the polio eradication infrastructure is playing a critical role in protecting communities from the pandemic. It might seem invisible, but it's a vast disease-fighting toolkit that surveils for traces of the polio virus and tests thousands of samples every year, and focuses critical resources through hubs and emergency operations centers, maintains a sophisticated logistics network to safely deliver vaccine, and trains health workers to inform the community of the importance of immunizing children. Now, Rotary and its partners are using this polio infrastructure to also help respond to the COVID-19 pandemic. Surveillance is a cornerstone of the polio eradication effort. In Ethiopia, community volunteers are now reporting suspected COVID-19 cases. And community health workers conduct house-to-house visits to identify suspected cases. Knowledge and information hubs like emergency operations centers are central to polio eradication activities in Pakistan, Afghanistan, and Nigeria. They are now also used as coordination centers for COVID-19 response, where polio partners develop plans, analyze data, and quickly share information, all in a centralized location. In Benin, teams created a national interactive dashboard, tracing contacts, mapping cases, and managing data. In Pakistan, Rotary's polio resource centers offer COVID-19 training for health workers, and one center serves as a testing site for the community. Across regions, the logistics network used to distribute polio vaccines is now essential in getting personal protective equipment to remote areas. In Pakistan, trained staff have collected thousands of COVID-19 samples. And teaming with UNICEF, Rotary distributed more than 3 million bars of soap to households in vulnerable areas of Afghanistan. Because good hygiene protects against polio and COVID-19. This infrastructure relies on the trusted voices of community influencers. The relationships they build ensure accurate health information protects the community against polio. In Afghanistan, 70,000 of them have been trained by the polio program. Now hundreds of thousands of households have access to critical polio and COVID-19 prevention information. Rotary and our partners built an infrastructure that is now addressing the largest public health crisis in a generation. We should be proud of this contribution. And eventually, when planes, boats, trains, and cars carry people around the world and viruses travel with them, this infrastructure will live on to tackle public health priorities and ensure a polio-free world. Your ongoing support for polio eradication will leave behind this everlasting legacy for decades to come.
I'm Jeffrey Kluger, editor-at-large for Time magazine in New York City. I've been researching and writing about the history of the polio vaccine for decades. You may not know this, but propaganda arguing that vaccines were dangerous to children was present in the 1950s. But still, over 1 million children in the United States lined up to participate in the Salk vaccine trials, knowing that science could make polio preventable. These children are known as the polio pioneers.
I had a friend whose brother had polio, and I remember he didn't have much use of his body from his waist down. He used crutches.
Dad and mother saying that we're going to make you to part of a study that may help you not get polio.
I remember when my parents talked to me about the polio trials, and they asked me if I wanted to help. And I said I did. I did want to help.
There was no debating. I was going to be at the head of the line because my mother had polio.
Before the summer of 1954 and 1955, when the vaccine was proven safe and effective, Do you recall how terrifying those earlier summers were?
I remember how bad summers were in New York City. There were swimming pools, and they would all close.
There was a period of time in the summer when the beach was closed, in the picnic area.
The most vivid recollections I have were of children with braces on their legs and on their arms.
In many ways, we're reliving the summers of 1954 and 1955 as the COVID-19 pandemic continues to rage across the world and similar vaccine trials are underway. What parallels do you see between 1954 and 2020?
Polio affected children more than adults, and today the greater consequences are with older adults. It still can affect any age group, and it affects a family unit.
It is lethal, and it is frightening.
And we're also facing the same racing against time as the doctors and researchers did then and what they're doing now.
Because it's a new disease, I think there's a lot more unknown. You know, polio was unknown. It was awful, but it was known.
It's so very interesting. They talk about when will the vaccine come? Will it be soon? Will it be this year or next? From my very biased view, I think about that, but then I also think about, I hope there'll be volunteers.
Heroism is achieved in big ways and small ways, public ways and private ways. You were one of the children involved in the field trial. When you were done, did you feel like a hero?
The word that comes to my mind is pride.
I felt really good when I saw my mother afterwards. It put it all together for me, and they made me feel like I was very special and that I was contributing something.
It felt so special, but I couldn't understand what was so special about it. It wasn't until after I joined Rotary 18 years ago that I really thought about the impact of what I had done.
My family, my mom and dad, when they talked to me, they didn't talk about doing heroic things. Mm-hmm. We were talking about helping kids. It wasn't a time for heroics. It was a time for helping each other. That's what that was.
Thank you to our polio pioneers for sharing their memories of the early years of immunizing against polio. When my mother passed away not long ago, while sorting through her keepsakes, I found my own carefully preserved vaccination records, showing that I too had been immunized against polio in November 1955. We know that vaccines work, and now we must continue our fight to ensure that children have access to them for generations to come. This year we are celebrating another milestone on the road to eradicating polio. The African region has been certified wild polio free. Marie Arène Richmond Ahua from Abidjan, Côte d'Ivoire, has been tirelessly working with Rotarians across the region to make this a reality. Let's hear from her now.
Je suis membre du Rotary depuis près de 30 ans. Ancienne gouverneure de district, ancienne présidente de la Commission nationale Polio Plus de Côte d'Ivoire pendant près de 20 ans. J'assume présentement la fonction de coordonnatrice du Rotary pour l'Afrique francophone et représentante du Rotary international à la Banque africaine de développement, la BAD. La certification de l'éradication du poliovirus sauvage a été rendue possible par les millions de personnes à travers l'Afrique qui se sont engagées à atteindre cet objectif. Nous avons vacciné des enfants, sensibilisé les parents et mené un plaidoyer en faveur du financement de cette initiative massive de santé publique. Et cela n'aurait pas été possible sans le docteur Tunji Fonsho, président de la Commission nationale Polio Plus du Nigeria depuis 2013. C'est un médecin, un père, un grand-père, un rotarien engagé. Et je suis fière de pouvoir le dire, mon ami. Il a été désigné en septembre 2020 parmi les 100 personnes les plus influentes dans le monde par le magazine Time. Il rejoint ainsi une liste impressionnante qui a déjà honoré dans le passé des personnes comme Oprah Winfrey, Angela Merkel, Nelson Mandela et le Dalai Lama. Je le félicite pour cet honneur et je le remercie de son dévouement sans faille envers les efforts d'éradication de la polio.
Thank you, Maria Irene, for that kind introduction. I'm overjoyed and humbled to be included in Time's 100 most influential people. However, the African region could not have been certified as wild polio-free without efforts of Rotarian members and leaders in Africa and across the globe. Rotarians helped Africa achieve this status by holding events to raise funds and awareness for polio. They also worked with governments and leaders to secure funding and support for eradication. Countless others donated their time and money in support of Rotary's Polio Plus efforts. Polio eradication is truly a collective effort. So thank you to everyone who have contributed to eradicating wild polio in Africa. This accomplishment belongs to all of us. Here to help us celebrate a wild polio-free Africa are Rotarians from around the continent with a special guest or two. So take a look.
Five years ago, we nearly eliminated wild polio in Africa.
But all great achievements are threatened by setbacks.
And so the work continued.
We recommitted ourselves to defeating this disease.
Knowing that our children could live in a world without polio.
In a world without polio.
Without polio.
Without polio.
Health workers, partners, governments, parents, Rotarians.
1 billion determined people.
Work across borders and languages.
Rising up, knowing that it would take everyone to get it right.
That's the Africa we all know, strong, resilient, unstoppable.
Rise up and celebrate.
Rise up
and celebrate.
Rise up and celebrate.
We've always known what we can accomplish.
And now, so does the rest of the world.
So does the rest of the world.
So does the rest of the world.
And now, so does the rest of the world.
Wow, this effort required incredible coordination and cooperation between governments, UN agencies, civil organizations, health workers, and parents. I know how proud I am of what we have accomplished, but we're not yet done. Wild poliovirus still exists in Afghanistan and Pakistan. Let's travel to Afghanistan to see how health workers in the field share information and deliver vaccines in remote communities. Because the world can't be free of wild polio until we reach every last child.
سهار تقریبا پر 4 بجې زه راکښېنم د مسجد ته اوداسه و د لمانځه غم خورم لمونځ چې مې وخوړی د هغه بعد چاوې دي د چاو څخه وروسته زه د خپلې ورځې پلان موږ د دوی سره میټینګ لرو د دوی سره کښېنو که هغه علما یي که هغه قومي مشران یي ټوله په جریان کې اچوو د دغه پولیو په هکله باندې یا د اتو نور ډولو واکسینو په هکله باندې د اپسل صحې په هکله باندې د مور د شیدو په هکله باندې د ماشوم د تغذیې په هکله باندې و دا خلکو ته معلومات ورکوو خلک په دغه اهمیت پوه کوو هغه بس بیا په د اهمیت چې پوه سي خپل ماشومان هم واکسینوي هغه نور واکسینونه هم کلینیک ته ورځي خلک هڅه چې خلک واچېږي و کلینیک ته ولاړ شي
دغه خلک ساته ناسي که چېرې دلې راشي دغه ځای خو یې پلاډکس بیا
دلته موږ ستونزه درلوده چې خلکو واکسین نه کاوه د داسې پنځوري قومي مشرانو د علما کرامو سره موږ دلې دغه غونډه درلوده چې دغه ځای ته زه ورته رالم او ډاکټر صاحب د نور همکارانو په شمول باندې هغه ستونزه حل شوله. هغه کم کوچنیان چې دي هغه دا یو اوس واکسینوو. د دغه ستونزې په اساس باندې دا غونډه جوړه شوې وه.
بس تکلیف کوي
اصلاح شو د آینده دپاره هر وخت به واکسین کوي.
او ان شاء الله دا کول هم دغسې کړی دی، بیا وروسته داسې بیا ان شاء الله ممانعت نه کوي.
هر ورور موږ په دغه باندې پوه کړو چې خپل ماشومان په خپل طبیعت یا موږ ته راوباسي واکسین کړي، او یا که موږ نه یې راغلي باید دوی کلینیک ته بوځي. دا خلک دغه ته متوجه کړو، ویې هڅوو چې دوی کلینیک ته په خپله رضا په خپله خوښه بوځي واکسین یې کړي. دا زموږ پروګرام معنا دغه لري چې دغه بار چې موږ اوس پسې ګرځو دا د دوی پر غاړه ور واچوو، دوی تر خپل ماشومان تر نږدې کلینیکه پورې بوځي، د دغه 8 ډوله 9 ډوله واکسینونه او د پولیو واکسین ورکړي. په بیابان کې یا په کوم اجرات کې چې وو، نو موږ ته بیا وینې د یو ډاکټر سو چې ډاکټر امین په نامه باندې هغه د پولیو څاڅکي واکسین بیا ګرځاوه. دا کوچنیان بیا واکسینول او د نورو واکسینو په هکله بیا موږ ته معلومات راکاوه چې د هغه ځای سره عباس و. دلته زما دغسې ماشوم خوښ دی چې هغه تندرسته یي، صحتمند یي، هغه هم زده کړه کولی سي، هم تعلیم کولی سي. نو ما په دغه وجه باندې په دغه پروګرام کې برخه واخیسته.
Thank you so much for joining us today and for everything you do to support this global effort. We can't finish this fight without your advocacy, fundraising and awareness raising. I can't wait for the day when the entire world is wild polio free. But I also want to celebrate what we've accomplished this year, and what better way to celebrate than music. Here's polio ambassador Angelique Kidjo performing Umbamba.